Hey folks, thank you so much for joining us. We have a great panel discussion put together for you today. Let's waste no time, introduce the panel to you. Dr. Andy Dunn, he is Chief of Staff at Wyoming Medical Center. We also have Ingrid Long. She is the Chief Nursing Officer at Banner Torrington Community Hospital. And we have a nurse, Rochelle, is joining us from the Cheyenne Regional Medical Center. Thank you all for being here. We appreciate it.
Thank you
for having us.
You got it. Ingrid, let me start with you because we nationwide, we've seen this new data coming out, and whether it's the second wave or a continuation of the first wave, who knows, but the numbers are going up. That is not good news. What are you seeing in Wyoming?
Yeah, so we're seeing a second surge of COVID-19 across the United States. And right here in Wyoming, we are seeing positivity rates climbing in many of our communities. Our state has one of the highest reproductive rates in the country, which means that COVID-19 is spreading more quickly here than it is in most other states.
So, Rochelle, let me ask you then. You're a frontline worker. Going by what Ingrid just said, I mean, what are you seeing?
Well, the hard thing with COVID is it varies. So you could have one person who just needs oxygen and a little proning and some steroids, and they do great. And then that next person is in the ICU. They're on a ventilator. I mean, they're needing proned. I mean, and we are doing everything we can, and it's just not enough. And they're not making it. And it's just really rough to see them fail to survive.
Yeah. If it's not enough, then we have to go back to square one, if you will. And Dr. Dunn, let me ask you, because we've been hearing about this since, late January, but what are some things that people really need to know, whether we're talking about putting themselves in situations or not putting themselves in situations, and activities to avoid so as not to get a positive result? What should folks be remembering?
I always tell people, be boring. Stay in your bubble, be boring, stay home, and just be in your cohort, your family. Avoid the big gatherings, 10 or more people, wear your mask, and be around those that are wearing their masks as well. We know that this virus is highly contagious, obviously, on top of respiratory droplets, aerosolized particles, and so the better chances of not transmitting this virus is, one, for you to wear the mask, and then from receiving the virus is having others wear the masks too. So don't put yourself in situations where there's a big gathering of people and people aren't wearing their masks. And just be boring. Stay home during this time.
Yeah, it's tough for folks to maybe understand that, especially as we get into the holiday season, but it's vital to heed what you just said, Doctor. No question about that. Rochelle, let me go back to you and ask you, kind of building off of what Dr. Dunn said about being boring, but being boring and making sure you have a mask on as you're being boring. Is that correct?
Yeah, I mean, there's two different things that we really need from the community. One is support. When this first hit, I mean, everyone was like, they were making masks. They were all about whatever we needed and whatever the community needed to get through this. But now as it's spread for a longer period and people are, experiencing the emotional, the economical struggle, there seems to be a lot of anger, and that's being pushed out. And so they don't want to wear their mask. They're struggling with it. So, I mean, mask up, keep your distance. Those studies are showing that 48 hours before you even have symptoms, you are actually contagious. So, it's not enough just to wear your mask when you're contagious or you have those symptoms. Wear it all the time, because, I mean, at the end of the line, you might be okay with not wearing a mask, but do you want to be that person that tells that other individual that their loved ones didn't survive because you didn't wear a mask? I mean, it's that serious. Yeah. We need to focus.
Yep, focus. And Ingrid, and from your perspective, what concerns do you have about, because back, 6 months ago, we thought, okay, by this time, we'll have this under control. And here we are, and it's not under control. What are your concerns about finally wrapping this up and getting our lives back to normalcy? Can you see that in the future?
I think we absolutely can if we all pull together and follow the rules, wear our masks, social distance, be boring. But it is very concerning. The spread is hitting Wyoming, and we just don't have a lot of resources. Every day we're reaching out to each other, saying, how many beds do you have at your hospital? If we don't get control of this, it leads to increased hospitalizations and unfortunately, increase in deaths.
Definitely. You run out of beds, and where are people going to go?
Mm-hmm.
Dr. Dunn, let me throw it back to you. If someone does test positive, that just hearing that may be scary. Dealing with the illness is the virus is one thing, but what should someone do if they test positive? What's the very first thing?
Go to a quarantine situation. First of all, you have to realize too, it's not your fault. There's this seem to be a scarlet letter when you're positive, and truly it's so transmittable so, that we're behind the 8 ball throughout the current as we go through our day. So it's not your fault. But go to your home, go to your apartment, go to your house, and just be by yourself. Quarantine yourself as best you can, even with your family members. Try and isolate yourself as best you can. Wear a mask at home. Stay home. The county, the state health departments will call and give you more further details about the order set for quarantine. But the best thing you can do is just hydrate, keep up with your daily activities in your home life, get plenty of rest, and just stay away from others.
Are you guys in Wyoming seeing what, I guess the only silver lining of this is not a lot of people who contract this virus go into that serious stage. Are you seeing that, or is the uptick in folks being admitted into the hospital and heaven forbid being on a ventilator in this second wave? What are you seeing? Rochelle, let me go to you first on that.
Well, we're actually, compared to the first one, we are seeing a lot more people in our ICU. We are experiencing a lot harsher symptoms and problems as these people are needing longer periods on the ventilator, where, in a normal or a different illness, we don't see them that long on the ventilator. We're able to take them off. We're seeing progress. Here we're starting to see it's affecting other systems. I mean, coagulation, we're seeing it hits their kidneys. I mean, these other areas that it normally wouldn't be, and almost being on a ventilator is actually more detrimental right now than it is if you can stay off the ventilator with COVID-19. We're really struggling with that.
So again, wear the masks, right? Socially distanced. Dr. Dunn, be boring, right? I mean, yes. You can't say that enough.
That's right. And to touch on that, the increase in positivity rate, 35%, somewhere give or take, leads to increased hospitalizations. The severity index goes up and the whole thing, a domino effect. So wear the masks, stop the spread. We know that the masks work. We know that it works. We know that distancing works and being boring works. And if that's what it takes to slow this down, let's do it all together. And that's truly our best defense at the moment.
Let's end it there. Hopefully we provided some great insight to the viewers. We appreciate it. Dr. Andy Dunn, Ingrid Long, and Rochelle. Thank you so much.
Thank you.
Thank you.
And folks, we'll see you next time.